The open enrollment period to review your Northwestern University benefits begins on October the 25th, 2021 at 8 a.m. and ends on Friday, November the 12th, 2021 at 5 p.m. In this presentation, we will define what open enrollment means. Then we'll cover what is changing as well as what is not changing, followed by an overview of the health, dental, vision, FSA and HSA plans, and finally we'll cover the requirements for changes to life insurance and to the LTD plan. If you are a Northwestern University faculty or staff member, open enrollment is your opportunity to review coverage options for the coming year and choose the benefits coverage you want and benefits coverage you and your family need for the coming year beginning January 1 of 2022. All the changes you make are made online via the MyHR portal after selecting the benefits tile. Let's talk about what is changing. Northwestern is excited to introduce pet insurance from MetLife. This is coverage for your cats and dogs with premiums based on your zip code and breed. Simply go online to the website listed here or call 800-GET-MET8 for a quote. Inform them that you are a Northwestern University employee in order to get the preferred pricing. Enrollment and payment are done directly with MetLife. Key benefits for this pet insurance includes a quick 3-step enrollment process with hassle-free claims experience, straightforward pricing and options with an experienced team of pet advocates. You are billed by MetLife and you will pay them directly, so no payroll deductions. Let's move on to our medical plans. Health insurance premiums have increased for 2022. Be sure to check your coverage and salary tier to locate your new premium. These new premiums are located in the Open Enrollment Guidebook and will also appear in the MyHR benefits system once you have logged in. There were no changes to the health plan design, so your office copay, co-insurance and out-of-pocket maximum has remained the same. And telehealth coverage will continue through all of 2022. We continue to offer 4 medical plans administered by Blue Cross Blue Shield of Illinois. The Premier PPO, which has the lowest deductible, co-insurance and out-of-pocket maximum for the highest premium. The Select PPO, which has a higher deductible, co-insurance and out-of-pocket maximum for a more affordable premium. And then the Value PPO, which is a high deductible, low premium plan with an associated HSA plan with matching university funds. Potential out-of-pocket expenses vary by plan and also vary by services received from Northwestern medicine providers or from in-network or out-of-network providers. These PPO plans offer the flexibility to go to any provider you choose, and if you choose to use Northwestern medicine providers, you receive a higher level of benefits coverage with the lowest out-of-pocket costs. We also offer HMO Illinois, where you will receive 100% coverage when using the HMO Illinois provider network. HMO Illinois pays no benefits if you go out of network, and this plan is not part of the Northwestern Medicine Tier 1 providers. All 4 medical plans pay 100% of the cost of preventative care. All 4 medical plans also provide benefits towards the cost of prescription drugs with Express Scripts as the pharmacy benefit manager. Whichever plan you choose, you can enroll in coverage for just yourself, or you may include 1 or more eligible family members under your coverage as well. We continue to offer 2 dental plans, either Guardian DHMO or Blue Cross Blue Shield PPO Dental and iMed Vision coverage. These plans have not changed their plan design. The Blue Cross Blue Shield of Illinois PPO Dental Plan has higher premiums but offers flexibility to go to any dentist in or out of network. You also receive higher benefits coverage for services when using Blue Cross Blue Shield of Illinois in-network providers. The plan covers the full cost of preventative services twice a year when using an in-network dental provider. If you choose to enroll in the more affordable Guardian DHMO plan, you and your covered family members must each select a primary care dentist who participates with Guardian's managed care DHMO plan. You may only receive services from your nominated dental provider under this plan. This plan also covers the full cost of preventative services twice a year. iMed Vision continues to offer comprehensive coverage with a $10 eye exam copay, allows for eye exams once every 12 months, as well as new frames and contact lenses once every 12 months. iMed has a large national network of providers, and you can go to any optometrist to receive coverage. However, you will receive higher benefits for services from a provider who is a member of the iMed provider network. Our life insurance and LTD plan design and coverage is not changing. There have been no changes to the tuition plan nor any of the tuition benefits offered. Make sure to check our website for the most up-to-date information. Healthcare FSA plans require you to re-enroll every year in order to participate. Use these tax-free dollars to help you pay for your eligible healthcare expenses incurred by you or your family members. If you are enrolled in the Premier PPO, Select PPO, or HMO Illinois plan, you can contribute to a traditional healthcare FSA plan. Or, if you enroll in the Value PPO, you can contribute to a limited use healthcare FSA plan. You determine how much to set aside as an annual pledge from $240 to $2,750, then use these funds to help pay for out-of-pocket expenses like physician office copays, prescription copays, or dental and vision copays. Payflex is the plan administrator. Remember, this is a use it or lose it plan, so planning is key, as any unused contributions can be forfeited as of the claim filing deadlines. These funds do not roll over and are not portable. The Health Savings Account, or HSA plan, requires re-enrollment every year in order to participate. You may only enroll in this plan if you are also enrolled in the Value PPO plan. The IRS places restrictions on employee contributions to this plan as well. For 2022, it is $3,650 for single or $7,300 for family. You may use these funds to help you pay for qualified healthcare expenses for you and your family, including deductibles, copays, and eligible services not covered by your health plan. Payflex is the administrator of this plan, and the funds will roll over year to year and are portable if you leave Northwestern. Northwestern University continues to offer a matching contribution to the HSA account. If you elect you-only coverage, Northwestern will match up to $1,000. Or if you elect family or U plus spouse or U plus children coverage, Northwestern will match up to $2,000. Remember, you can contribute additional pre-tax dollars via payroll deduction into this account up to the IRS limits, but Northwestern will only match up to the set contributions already described. You can also make changes to these amounts throughout the year via the MyHR benefit system without needing an IRS life event. The Dependent Care FSA account is a pre-tax savings plan used to help pay for qualified dependent care expenses such as preschool, daycare, summer day camps, before and after school care. This plan is available to full-time benefits-eligible employees whose spouse is also working full-time or is a full-time student. This plan requires re-enrollment every year. Qualified dependents are typically your children, 12 and under, but can also be used for disabled children over age 13. However, they must be declared as your dependents on your tax return. Expenses must be incurred in the calendar year in which they were made, from January through December for 2022. The minimum annual pledge amount is $240 and the maximum is $5,000. This is also a use it or lose it plan, and it does not roll over. If you are enrolled in the Dependent Care FSA plan, Northwestern University also offers a matching contribution. Northwestern University will reimburse the match directly to your paycheck as earnings, and the amount is equal to a percentage of your contribution based upon your annual pledge and your prior year's adjusted gross income from your tax form 1040. To be eligible for this match, you must be a full-time employee with a spouse working full-time or studying full-time, and your combined adjusted household income is $130,000 or less. The match application form must be submitted annually, and the match application form is submitted online via MyHR. During open enrollment, for changes to the basic term life insurance plan, you may change from the no-cost automatic coverage of $50,000 to the 2.5 times your salary up to the max amount of $250,000 or vice versa. You can also enroll or increase coverage amounts for your supplemental term life plan or your spouse and dependent term life plans. Any changes you make would require completion of the EOI, Evidence of Insurability form, and is subject to vendor approval. For long-term disability, you may enroll or waive the 10% buy-up plan during open enrollment. If you are enrolling in the buy-up plan, then you must submit the EOI form, and this is subject to vendor approval. We would like to remind you that you must re-enroll in the Healthcare FSA, Limited Use FSA, Dependent Care FSA, and HSA accounts every year at open enrollment. This is because our plans do not automatically roll over year to year, and we do not know what your out-of-pocket expense needs are year to year. It is also extremely important to take this time to review who you have named as your basic term life insurance beneficiaries and to make any changes needed, especially in these uncertain times. To review the beneficiaries of your 403B retirement plans, you will need to go online to the Fidelity or TIAA websites directly. Remember, open enrollment will end as of November 12, 2021. For any general questions you have concerning open enrollment, you may contact us at 847-491-4700 or send us an email at askhr@northwestern.edu. Remember that Dependent Care FSA match application forms are submitted online via MyHR and that you must upload any dependent verification documents directly into the online enrollment platform. Lastly, we encourage you to visit the benefits website at northwestern.edu/hr/benefits as it is the most updated resource available to you and is also the best place to research all of the plans we offer in more detail and hopefully should answer any further questions that you may have.